Ready to go?
Yep.
Let's roll them. My name is Fred Klingenhagen. We'll be talking about STDs. Fred, like on the bottle, it's a guy in Brooklyn. Makes Fred water. And I love it because it's the only bottled water that's shaped like a flask. When I go to juvenile and stuff, somebody would say, our kid came in the other day and says, is that vodka? I was like, yeah. I'm going to come into the juvenile center. Have you been driving? But officer, I had to drive. Well, why is that? Because I couldn't walk. So I don't know. This is actually spring water. Guy in Brooklyn makes it. Spring water, swear to God. Okay. Since we're going to talk about sex, sexual anatomy, sexual activities and things, and you're going into the profession, I think it's important when we're talking about the male and female anatomy that we use clinical terms. That way there's no misunderstanding. It's a very personal thing. So, for the purposes of the class, the male genitalia will be referred to as, anyone? Nope. Mr. Lucky. And the female genitalia as the lovely and talented Tutti Fabulous. So it's kind of like this, 2D, 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 I'm Mr. Lucky, and you're looking absolutely fabulous. Why, Mr. Lucky, you're not the penis I was expecting. Okay, first question. Can somebody tell me what a player is? Do we have a player here? And I don't mean a player, I mean a player. Anyone? That's right, multiple sex partners. Yes. And can there be female players? Yes, there can be. Well, one of the most amazing things that you will learn in this class is that there was a time, back when I was younger, back in the late 1800s, when I was younger, that if the bar was dark enough, she had a lot to drink, and a lot, right. Oh, wait a minute, yeah. Now, there was a time that if the bar was dark enough, and she had had tremendous amounts of alcohol to drink, and the light hit me just right, and I get the bangs right too, might I? You get the bangs right. That was pretty cool. It was almost like an optical illusion. I could almost appear handsome. Of course, the biggest factor in how handsome I appeared was, anyone? How much alcohol I could pump into the object of my affection for the evening. And in my single days, used to do a lot of playing, used to happy hours and the ladies' nights and all that stuff. And this was kind of in the days where they first started having the ladies' nights, where no cover charge for the females, free booze of all kinds, all night for the ladies, for free. Hallelujah, 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 hallelujah. You mean you're going to get all those women drunk off their butts so that they're going to want to have sex with me. Is this a great country or what? They used to have this place at Champagne Nights. Champagne Nights was the greatest. So you guys know an old movie called Wedding Crashers? You ever seen that? Yeah. Picking up some strange on Champagne Nights was like shooting fish in a barrel with a grenade launcher. It was incredible. Oh, geez. 9 o'clock, open the doors, start pouring in that very fine Andre vintage champagne. You know, the stuff that goes for like $10 a case. So by midnight, you know, these women are hanging off the ceiling fans, breaking beer bottles over the bar. It's like, oh, well, let's have sex. Well, yes, ma'am. Excellent. Okay. And in my single days, I was infected with gonorrhea 3 times. And I could use that one again. And as you guys know from your study, gonorrhea. Can somebody spell this for me? Do you know how to spell gonorrhea? Close enough. Caused by bacteria. And usually about a week to 10 days after exposure, I get a little milky discharge out of Mr. Lucky. And then you go to pee. And the ammonia in your urine hits that infected tissue, and it is like peeing razor blades. I had, 3 times. I got gonorrhea twice in college, once when I was here in early 20s. And every time, the symptoms would come Friday afternoon. And the clinic wasn't open till Monday morning. So I will give you a direct quote from Mr. Lucky, standing over the urinal, peeing, full outbreak of gonorrhea, and Mr. Lucky is going, quote, "Yo!" unquote. Wait for the shake. But I knew, go to the clinic, get some antibiotics. Usually they'll give you a shot. And then about 2 weeks of pills. And these antibiotics will kill the bacteria. Week to 10 days. Ladies' night. Champagne night. Back on the street. Does anybody know the other 2 major bacterial STDs? Yes, ma'am. Chlamydia. Very good. And thanks for saying that one, because I know how to spell it. I think. Maybe not. It's either chlamydia or Alameda, California, one of the 2. Symptoms for these 2 are similar. Some type of milky discharge, pain, urination. Now, since the ladies' physiology is a little bit different than the men, may not get the pain urinating like the men, but symptoms are fairly the same. And the third one, does anybody know what that is? Syphilis. Very good. And syphilis is kind of interesting because the only outward sign you have is syphilis. About a week today, 10 days, very good. About a week after exposure, this little kind of painless rash, pain, this little red place. Lasts for 6 or 7 days, then it goes away. You go, huh, okay. Maybe you had an allergic reaction to some soap or something, you know? But I had this little kind of blemish on my genitals and no pain. Week or 10 days, goes away. Hey, okay, well, not necessarily. And although there's not a lot of syphilis around, these days. It's possible. And just like all these bacterial infections, if they are not treated in a timely manner, then they can cause more serious health problems. The biggest thing for ladies, untreated, can affect, in really serious cases, affect their sterility. For men and women, it puts them at higher risk for catching viral STDs. Oh boy, that sounds like fun. And that's because once the immune system starts fighting this losing battle against the bacteria, starts popping up them white blood cells. And that activity can put a person at higher risk for catching viral. And the biggie, of course, is HIV. And if someone has HIV long enough, what happens? AIDS. They got AIDS. And we're going to talk about this a little more in depth. And in severe cases, not as prevalent now, it could cause death. And some people are still dying of AIDS-related complications. And we'll discuss that a little bit more in depth a little later. There's another couple of viral STDs. Anybody know what they are? Herpes, very good. Herpes is basically cold sores. You get a cold or flu, get a little sore there. My mother used to call them fever blisters. My mother lived in New York for like 50 years, or grew up in New York. Didn't live in New York for like 50 years, still talk like a Jaboni, you know what I mean? She's called them fever blisters. We never knew what she was talking about. And basically, genital herpes is those nasty blistery cold sores on your junk. And for the guys, what you see is what you get. If there's going to be a sore, it's going to be on Mr. Lucky or on his baggage. Oh, very good, sir. Where do you want these bags? Excellent. I'm going to play those three hip chicks in the middle there. For the ladies, could be a sore on the outside, or it could be a sore on the inside. And even the woman may not know she's having an outbreak. And of course, the fear for sexual partners, if they're having unprotected sex, is they may not. If the woman doesn't know, the guy certainly isn't going to know. Unless you're like me. I like having sex wearing one of those miner's caps, you know, with the little light on it. So I go, hey, what's going on in there? Tip for you guys, by the way. You don't want to try having sex wearing one of those miner's caps without, because it really breaks the romantic mood. And they have treatments. And usually what an outbreak will consist of is little red blotch. It'll start to get itchy, and then it'll start to blister. Little bitty blisters, you know, even a dozen blisters or so. And then those will kind of blow up, just like when you're raking the leaves, you know, you get a callus and that clear liquid comes out. That's kind of what you get. And they do have general antivirals that you can take, acyclovir, Zavorex, those type of things. But they are not a cure. And they have to be taken to reduce the severity and the length of the outbreaks. But again, they are not a cure. And then the final one, does anybody know? HPV, human papillomavirus. And that causes genital warts. Oh boy, genital warts. I have a plain old ordinary wart. You're not going to be able to see this on here. I've had it for about 50 years. It's got a little hair growing out of it just to make it even more lovely. And yeah, you pick a pimple, yeah, and it kind of scabs. It bleeds a little bit, then it scabs over. If I pick this like a pimple, within about 5 minutes, it'll look like we had a knife fight in here because it's being fed by a virus. And if you catch the human papillomavirus, the genital warts, which can give you these nasty bumps on your junk. And again, with the guys, what you see is what you get. It'll be on the outside. Ladies like herpes, could be on the outside, could be on the inside. And then we're back to the miner's cap with a little light on it. And they do have 2 treatments for these. Outpatient procedures, where they can freeze them off, or they can burn them off with a laser. I don't know about you guys, but I made it a personal lifestyle goal of mine that I don't want any bozo around Mr. Lucky with a friggin' laser. I don't know, I'm just picky that way. I mean, you get a doctor with bad aim. Oh, there goes Lefty. Oh, no. And the interaction, herpes particularly, with a higher risk for HIV, of course, is that's a sore or a developing sore, if not a full sore. And herpes can be transmitted a couple days before the sore actually appears. You don't have to have a visible sore sometimes. Just have to have that virus active, where then they could actually transmit the herpes virus. And that can obviously put you at higher risk for HIV if somebody's having unprotected sex with somebody with HIV. And so, we're going to talk at length about HIV, unless anybody has any questions about the other STDs. Dangerous thing about HIV is, can you tell when somebody has HIV by looking at them? Very difficult. Because if somebody is infected with HIV today, for about a week, they will start to have cold and flu-like symptoms. That makes sense. HIV is a virus. Its initial attack would probably feel like some type of cold and flu-like symptoms. And what's happening is the HIV virus is starting to infect the person's white blood cells. These little circles are white blood cells, and everybody knows what white blood cells are. Yes. And what can we tell me? White blood cells? Your immune system. And what happens is the HIV starts infecting those immune cells. The immune cells in your body that's supposed to protect you from bacteria, other viruses and stuff, messes around with the DNA structure of those white blood cells, turning them into little HIV manufacturing plants. And after a body is infected with the HIV virus, that body starts producing HIV DNA in the system at a rate of 1 billion cells per minute. Amazing thing happens after a week. You start to produce HIV antibodies. That sounds pretty good, right? Affected by this lethal virus, but the body is starting to produce HIV antibodies. Oh, okay, that sounds pretty cool. Unfortunately, these HIV antibodies are about as effective at stopping this cell infection as the, I don't know, we got any football fans? Miami Dolphin fans? About as effective as the Miami Dolphins against the rest of the NFL, you know? I mean, jeez Louise. Do you guys know how to do a rim shot? Boom-sh. Have you ever you get that? Where the comic will say, do a joke, and then they go boom-sh.
Oh, no.
Have you seen that? Okay, when I do that, I'll do my 3 dogman jokes for you. Because Ricardo's going to cut these out anyway. So when I go like this, you go, as a class, you go boom-sh. Okay? Ready? I'm going to practice one. Beautiful. Okay. I don't follow professional football. I'm a Dolphin fan. And it's halftime here at Dolphin Stadium. It's the New England Patriots 30 and the Miami Dolphins just watching. Then the final joke, the Dolphins are definitely going to the Super Bowl this year. I guarantee it. They just ordered their tickets. Thank you. You're so yeah, that's great. Here's the scary thing. After the first 4 days or so, the cold and flu-like symptoms go away. And usually, if untested, this will continue. And the person will feel better. And usually the second set of symptoms, usually the first set will be cold and flu-like symptoms, weakness, fever, swollen lymph nodes, that type of stuff, night sweats. Usually the second set of symptoms, which are those same kind of things, night sweats, swollen lymph nodes, that type of stuff, usually after the first week or so, will not reappear for 5 to 8 to 10. Does anybody know? Years. There are people walking around with HIV for a decade and do not know they have the virus. If they get tested anytime between when they think they were infected and 3 months, the test will show the antibodies. And if the person has the antibodies, that means they have the virus. If there are no antibodies present, there's no HIV for that body to fight. And so there are people that are rolling around in today's society, perfectly healthy, they think, but have the HIV virus. And that's what happened to me. Because after 30 years of playing, I met my wife. And she was this shy little Baptist girl from the west coast of Florida. And we got married. And I'm standing on the altar. I remember this moment for the rest of my life. 30 seconds before I'm going to get married. Start playing the wedding march. Wife's coming up, looking absolutely stunning. This is what's going on in my head. 13 seconds before I'm going to pledge myself to one woman, forsaking all others, till death do us part, I am thinking, what in the heck am I doing up here? And then I made a decision, life-altering decision. So I'm thinking, oh, it's my playing days. I had a girlfriend for about a year. For me, the sex would start to get kind of boring. I'd keep the girlfriend, but come on, guys, let's do some playing, you know? Big thing for us was to have a date with one woman, spend Saturday night with them, have sex Sunday morning, get rid of the regular girlfriend, and then Sunday night before midnight, have a new hookup and try and bag her before midnight, 2 in a 24-hour period. That was big time, that kind of stuff. And on that altar, I decided, nope, I'm going to change my life. And I am proud to say that in the 8 years we were married, I was never unfaithful to my wife, ever. And of all the work I'm done, HIV education, that is what I am most proud of. 5 years into the marriage, 5 years, we go on a cruise for our 5th anniversary, and Kathy starts to get sick. They can't figure out what was wrong with her, and they asked her about her premarital sexual history, and she said, well, I've had 2 sex partners my entire life, my husband and a fiance before me. And then they asked about my premarital sexual history, to which I immediately replied, gulp. I said, I don't know how many women I slept with. They decided that we should test for HIV. And both my darling wife and I tested positive for the virus that causes AIDS. I've had HIV for 25 years. I've been diagnosed with AIDS for 20 years. And back in the day, this was 20 years ago, about the time you guys know about Magic, right? Magic Johnson? Inspiration to everybody living with HIV. We were infected around that same time, or diagnosed around the same time. And back in the day, they only had 2 medications that you could take. Now they got a whole bunch, and we're going to talk about that a little bit. But in the day, they had Retrovir, AZT, and DDI. We gave my wife 1 AZT, got the new prescription, 1 AZT tablet. Affected her red blood cell production, shut it off like a light switch. 2 hours after we took the first pill, she took the first pill, we were at Winter Park Hospital giving her 2 units of blood to replace the red blood cells. 1 pill. And they still use this medication. So then the doctor said, okay, well, she can't take that. Let's put her on the easier to swallow big oval pills. And that made her even sicker. And after 3 years, she was 79 pounds, hooked up to an IV 12 hours a day to feed her, keep her alive. She had experienced all the opportunistic infections. Opportunistic infections are when your white blood cell count is so low and there is so much HIV DNA in your system, the body can actually start to turn against itself. That's kind of the best way to describe it. She had several bouts of pneumocystis pneumonia, the AIDS-related pneumonia. She had MAI, which was a digestive tract infection where anything she ate right through her system. She had peripheral neuropathy, which can kill the nerve cells in your extremities. She had it really bad in her feet. And she said to me one time, because I was her primary caregiver, when you put my socks on, my soft cotton socks, and pulled them over my feet, the neuropathy was so bad that she said it felt like you were scraping shards of glass against her feet. And one day, I came to her, and she was sitting on her couch, watching her soap opera, looking absolutely miserable. And I had not planned this. I came into the room, and just it popped out of my mouth. It wasn't like I had a long talk with God the night before. It just, honey, are you over this? That's what I said. Are you over this? And she said, I just want to go to sleep and I don't want to wake up. And that's when I made the easiest decision I've ever made in my life. It's been the most difficult to live with, but if you want, we can take you off your meds. I'll support you in that. And she said, yes. I can't take any more of it. And took her off her meds. We were like on death watch for like 2 weeks. And this is where I'm going to get all metaphysical on you guys. I wasn't at home. My mother-in-law was staying with Kathy. And at the time, I'd been her primary caregiver. I had been diagnosed at that point with AIDS. And my sister-in-law and my mother-in-law ganged up on me. Said, get him out of the house, take him down to the park. You know, get him some fresh air, get him away from all this stuff. I'll stay with Kathy. When I walked 3 blocks down the park, we hit the gate. And I say, we gotta go home. We gotta go home, we gotta go home. I got real agitated, we gotta go home, we gotta go home, we gotta go home now. My sister-in-law came like, well, I thought we were gonna relax for an hour or so, you know. And then I said, I don't care, we gotta go home, we gotta go home. She said, okay. And we walked the 10 minutes home. And my mother-in-law came out of the house onto the lawn. And very, very undramatic, un-Hollywood kind of endings. She just said, it's over. She stopped breathing. And I realized from 3 blocks away, I knew the exact second that she passed away, because that's when we hit we gotta go home, we gotta go home, we gotta go home. Gets a little spookier. Found out the day she died, because I've been doing this work now for almost 20 years. The day she died, National Make a Difference Day. God, you got a real dry sense of humor, you know that? And another thing, another kind of cosmic convergence of time and space, but first time I started this work was down at 33rd Street Jail. They wanted me to come the 4th Tuesday of every month, go to each dorm. Started the 4th Tuesday in October. Didn't plan it. 4th anniversary of her death. And it's funny because I was so glad that she got her final wish, because she went to bed about 11 o'clock Wednesday night, gave her a sleeping pill. She stopped breathing about 3 in the afternoon the next day and just fell asleep and, got her final wish. Just want to go to sleep. Thing she got wrong was about a week into Death Watch. She said, you're going to be all right. I'm not going to worry about you, Fred. Because, quote unquote, 6 months after I'm gone, you're going to meet somebody and forget all about me. Sorry, dear. I haven't been able to do that. And whether it's AIDS-related complications, leukemia, cancer, you just lose them gradually. Somebody has an accident, is killed, or has a fatal stroke or heart attack. That's tragic, and you do the grieving process, and you probably a lot of you have experienced that. Long-term illness, you lose them so gradually. First, it's like a meal at a time. No, I'm not hungry. And then enough missed meals. Then it's a pound at a time. And then towards the end, it seems like they just disappear on you. almost like a cell at a time. And the harder you try to feed them, the harder you try to take care of them, make them comfortable, it seems like the worse they get. And that's something to be aware of as you go into your profession, because that's what a lot of people are feeling on the other side of the examining table. And obviously in your careers, you don't want to become too involved personally, it's unprofessional, with your patients. But a lot of times you guys can make the difference with a kind word, compassion. And obviously you all have that, or you would be studying accounting, or going to law or something like that. The reason I'm still here was probably because I was able to tolerate those early medications. In fact, you would have never guessed I had anything wrong with me when I was diagnosed with HIV. I was 205 pounds. And that ain't 205 laying on the couch, gobbling beer and potato chips, ragging on the Dolphins. That's 205. In the summertime, I used to roll my free weights out into the full sun, full upper body set, full lower body set, run around my block in between, chop wood, play tennis. I look like an NFL linebacker. Now, I think I made it up to 165 pounds, which took me a couple of years. And yes, they have better medications, less toxic. Taking them in combination helps disrupt the cycle of HIV infection of white blood cells. Got HIV affecting these white blood cells. And in the early days, we had medications that slowed, didn't stop, but slowed HIV from infecting new blood cells. And then late 90s, proliferation of protease inhibitors, which was a big development in HIV treatment, because the protease inhibitors, now taken in combination, retarded this cell replication of HIV of already infected cells. So you could bar, at a cellular level, you could bar HIV from getting in this front door, plus closing it off from the back door. And that allowed people to become healthier, rebuild their white blood cell counts, get their viral load, that's viral load. How much parts per milliliter of HIV is in your blood, down to non-detectable levels. Remember when Magic was cured? Well, he wasn't cured. They just tested his blood. The medications had worked, got his blood count down to his, what's called viral load, down to non-detectable levels. And a lot of laymen thought, oh, he's cured. We tested his blood, non-detectable levels of virus. Well, to a layman, that makes sense. But if he stops taking his medications, that cell replication of HIV DNA will go wild. And they will also be resistant strains of virus, where you would then have to go on new medications. That was one of the things, to have several options from one or two. Because over my history, I've had several viral mutations where the medication I was on stopped working, had to go on to something else. And this was about 10 years ago. Well, we did the DNA on your thing, blah, 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 blah. Viromune's not working anymore. I said, okay, well, what do we take, doc? And back at that time, they said, sorry, Fred, we ain't got nothing else to give you. They went, uh-oh. And then fortunately I'm on now Kaletra, which was in a trial, a protease inhibitor, and I've been on that for like 10 years. And that has really helped. But here's the deal. Just like HIV affects your DNA, these medications have to affect your DNA. And side effects. I have very good insurance. Besides the $15,000 a year these medications cost my insurance company, side effects. Besides losing a quarter of my body weight, I've experienced headaches, high blood pressure, high cholesterol, chronic fatigue, muscle wasting. All of that weightlifting for 30 years, it's gone. I can't keep any muscle tissue on my legs anymore. Headaches, diarrhea, insomnia, depression, dehydration. And then I was also diagnosed, with HIV encephalopathy, which meant the virus got in my brain, started to affect how the neurons fire. And I call that CRS, which stands for can't remember squat. The other thing these things can do, they can, it's called lipodystrophy, unnatural fat redistribution in your body. And for me, I call that GMB syndrome. That stands for got no butt. It is eating all the fat off my butt. And if you notice, I ain't got no cheeks. I don't got cheeks in my body, either here or there. You know? No cheeks. I'm cheekless. I'm cheekless in Seattle. So not only am I elderly now, well, pre-elderly, but now I'm craggy-faced. So if you ever went to Hollywood and met Clint Eastwood, he'd probably go, damn, that guy's craggy-faced. That's my cheesy Clint Eastwood impression. Particularly women can gain fat on these medications. And usually where women will gain fat is around their waists. Couldn't do it a little higher, so it's more fun for everybody. No, it's got to be around the waist. And then have you ever seen like a 70, 75-year-old woman at the calcium deposit? It's called widow's hump. I bet my mother-in-law had that really bad. I knew a guy, he's about my age, bodybuilder, still in good shape, HIV positive, had the lipodystrophy so bad. He had a hump, but it wasn't calcium from age. It was fat redistribution. They took his license away because he couldn't do this. Now, he's got a 15-inch scar across his back. Had to liposuction the fat out twice. So, yeah, there's better pills. Yeah, Magic's doing good, and I'm taking nothing away from Magic. Magic is an inspiration to everybody, especially HIV, people living with HIV. But complacency sets in. And the last thing anybody wants to do is go on these medications. Trust me. So that brings us to, do you have any questions about that? How do you catch HIV? HIV positive person here. HIV negative person here. Anyone know the 3 ways you catch HIV? Unprotected sex with somebody that has the virus. Sharing needles, which makes a lot of sense. Hey, let's shoot up, you know? Then I give you a needle and you're going, wait a minute, you don't have HIV? Oh yeah, I'm gonna stick this in my arm. Very effective way of catching HIV. And the third way, no, actually the blood supply is pretty pretty safe now. DNA testing. There was a problem about 30 years ago with the hemophiliacs that got infected from tainted blood. Mother to child. Mother can pass it to their child either through the actual birthing process, because that's all HIV-infected blood, or if the baby does not, what they call seroconvert, develop the virus, breastfeeding. And I've got a very tragic story about this young lady I knew from New York. She got pregnant, and they said, we need you to test for HIV. And she said, I ain't gay. I don't shoot IV drugs. I ain't consenting to the HIV test. She was HIV positive, gave birth to a son. He contracted the virus. He lived to be about 4 years old, and then he died. And all she would have had to do was get the HIV test. They would have put her on the antivirals, got that HIV viral load down to non-detectable levels, did a C-section, lift the baby out. And the baby would probably be about 16, 17, which is the average age of the kids in juvie that I teach. Hopefully, he wouldn't have been in juvie, but, and that's all I would have had to do, one simple test. And yeah, he would have. And the babies had to have a tough time on these medications. If they do this to a full-grown man, you can imagine how difficult. And fortunately, because of what we know, last 20, 30 years, that is our one big shining victory besides the protease, is we've reduced seroconversion in babies down from what used to be about 25% down to less than 2. So that's an excellent. But as far as sex, how does a person, HIV negative person, catch the HIV virus? Through sex. Well, through blood, semen, and vaginal fluid. Saliva doesn't have enough white blood cells. So just swapping spit, making out, French kissing, playing tonsil hockey. And my favorite, I got in trouble with the Seminole County School Board because I said suck face to some 6th graders. Called into the office. Got ragged out. And the funniest thing was, at the end of the day, we're with the little 6th graders and we're waiting for the buses to come, you know. This little kid comes up to me and goes, what was Mr. Johnson ragging you out for, Mr. Fred? I said, well, he objected to me saying, suck face to you guys. And the little kid floored me because he just said, Mr. Fred, we're in 6th grade. We know what suck face means. Yeah, tell your principal. In fact, you guys know about the National Institute of Health, right? In Washington, D.C.? They test diseases and cures and stuff like that. Well, some highly disturbed researchers at the NIH did a test and determined to catch HIV just through saliva, you'd have to get a bucket and fill it with a gallon's worth of HIV-infected saliva. Where in the heck you would get that, I don't know. And then chug-a-lug at it once to be at risk. And my opinion on that is, if any of you guys are in a sick, twisted relationship where you're chug-a-lugging a gallon of your partner's spit, HIV is the least of your worries at this point. What they need to do is whack you full of Thorazine and put you in a room where all the walls are nice and soft so you can't hurt yourself. That's my cheesy Jack Nicholson. Oh, wait a minute. I forgot the glasses. Jack always plays better with glasses. And put you in a room where all the walls are nice and soft so you can't hurt yourself. Jack always plays better with sunglasses. So, how do these fluids get into the HIV negative fluid? Through sex, through your soft tissue. And everybody has soft tissue in their anus, which is the region of the buttocks, except for me, because I don't have one anymore. So, if a woman is having unprotected anal sex, doesn't know her partner's status, and he does have HIV, and she gets a nut in her butt, I got a story about that joke. There was this poor teacher somewhere in the did a gig, and he was a nice guy. He was the LMS teacher, the baseball coach, and all that stuff. And doing the gig, and probably up in Seminole County, and administrator comes in right in time for this joke. And poor baseball coach just puts his head down. I hadn't realized this. He was up for Teacher of the Year. And he put his head down and went, "There goes Teacher of the Year." It's fine. But gentlemen, there is a risk factor having unprotected anal sex, because if she or the bottom partner doesn't know their status and has HIV and is in there 5 to 8 to 10 years, never been tested, doesn't know they have the virus, the thrusting motion of doing the nasty in the butt unprotected can cause what the guys at the NIH call microfissures, microscopic tears in the skin tissue of Mr. Lucky. And that could be a risk factor, because if that skin is compromised, can be blood contamination. So that is the number one risk factor sexually. Okay, vaginal sex. Next place, gentlemen. Next place you got soft tissue. You're in the shower, soaping off Mr. Lucky, either for hygiene or personal recreation reasons. And you get some soap in the pee hole, what happens? It'll burn. This is regular skin tissue. He's fine. Mr. Lucky's having a good time. Boy, that soap's feeling really good. Mr. Lucky's like, Private Lucky reporting for duty, sir. Yes, sir. Get it inside the pee hole and it'll burn. That's the difference between regular skin tissue and soft tissue. So if someone is having unprotected vaginal sex, and again, she has the virus and doesn't know it, that gentleman is putting their pee hole in contact with a virus that can give them HIV. For the ladies, much easier for a man to pass it to a woman in straight sex, because while just the pee hole in Mr. Lucky is soft tissue, all of Judy Fabulous is soft tissue. So the women have more soft tissue to infect. And then the final place we have soft tissue is lining the bottoms of our mouths. So oral sex, the good news as far as HIV, because there's not a lot of HIV transmission orally. It goes back to the enzymes in the saliva and stuff. The bigger risk factor for STD transmission orally is herpes, HPV, much easier to catch because you need some fluid transmission with HIV. You also need fluid transmission with chlamydia, but not a lot of transmission. But the rule for oral sex is the giver of the head is at higher risk than receiver of said head. Your witness counselor. So, does anybody have any questions about that? Which brings us to, oh boy, I'm all excited. My favorite portion of the program. Ta-da. Can everybody see this? I brought some toys. I'd like to introduce my partner, Mr. Lucky. Mr. Lucky's not real. It's made of wax. Fortunately, because he's starting to turn green, so that's, Okay, male condom. What's the first thing you check for with the male condom? Nope. 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 The first thing you want to check for is the color, because we have a blue one. So now we can have mutant alien avatar sex. First time I saw the trailer for that movie, I went, "He made the aliens blue. I can use my blue condom joke. Yay." No, you guys were right. You want to check for holes. Make sure the package has not been compromised. And then expiration date. These are all expired, so we can't use them for sex, but we can use it for putting on Mr. Lucky. And you rip it open. Make sure you don't rip the condom. And you make a little sombrero out of the condom. So that Mr. Lucky is now Senior Lucky. And what you want to do, you want to roll it down. You want to pinch the top. Anybody know why you want to pinch the top? One. Pardon me? The ejaculate. You know why? Remember those highly disturbed researchers at the National Institute of Health I was telling you about? Well, it must have been a slow afternoon when they determined sperm comes out of a penis at 28 miles per hour.
How did they? I don't even want to know how they figure it out.
You know what this is? This is our tax dollars at work. That's what this is. Like I said, what like slow Friday afternoon? Hey, Bill.
I have an idea.
Yeah. In basket's kind of low. Yeah. Got about 2 hours till quitting time. Yeah, what do you want to do? Want to see how fast sperm comes out of a penis? Yeah. And how they tested for this, I got no idea. Would they get a radar gun and go, "Okay, Bill, start whacking." Right on there. You figure those little sperm cells, 28 miles an hour. It's probably not really fast unless A, you own my raggedy old Mustang, or B, you are a microscopic sperm. Then 20 miles an hour is booking. So these guys are kind of getting shot out of there. They're coming out of there like the Fast and the Furious, looking for ovum to fertilize. They're doing their Michael Phelps routine. All the ovaries are hanging around Ovum Beach going, "Oh, you nasty boys, come on in, let's go." Little sperm cells, So, makes sense. This is flush like this, more likely for this to break. So you do want to give it a little pinch, a little reservoir, and then after both the male and female, Mr. Lucky and Tootie have completed their mission parameters. The guy pulls out the condom while he's still erect, go debriefs Mr. Lucky. Now, how many Caucasian guys do we have in the audience? Just me? This one? Yeah, come on. Don't be shy. Go on. So I got some good news for us because they've got black condoms. Which will not increase our penis size, but can create the illusion of increased penis size. After my wife died, I want to joke about the black condom. After my wife died, I've had 4 relationships, 2 with HIV positive women, 2 with HIV negative women. The first one was pretty cool because I was 40 and she was 25, so I got to go through my midlife crisis. I didn't have to blow $100,000 on a Porsche. She was HIV positive, and her favorite actor was Denzel Washington. New Denzel movie? Yeah, I knew where I was going Saturday night. We were going to see Denzel. And she had the best line for Black Condom because she used to call him Instant Denzel Washington in a package. Me and Mr. Lucky are just going, whatever turns you on, lady. Yeah, we're getting some. Great, excellent. All right. Now, I did something wrong. Does anybody know what I did wrong? Why don't you want to do 2 condoms? Exactly. Besides the fact, put 2 condoms on, right? Mr. Lucky's going to be in there going, I'm going to do a thing in here. Are we having sex yet? Okay, I guess we are. Okay. So you just want to use 1 because the friction will cause that to break. And then, we've got some people, men. You know, I don't know if any of you ladies have come across this, but it's like, yeah, sorry, babe, can't wear a condom. Mr. Lucky's just too big. Available in fine pharmacies everywhere. Trojan Magnum. Ta-da! And then, of course, if you're like me, I'm part Italian. Even the Magnums don't fit. They have Magnum Extra Large. Ta-da! I'm extra large. Even the Magnums don't fit. And if these don't fit, you need to go on the Jerry Springer show because you are a freak of nature. So that is the male condom. We also have flavored condom. We've got a bubble gum for oral sex because KY and latex is not the most appetizing substance. So this is bubble gum. Woohoo! So that will be used for oral sex. Now, has anybody ever used the female condom? Anybody familiar with the female condom? Anybody ever used them? Did you? What'd you think? You didn't like it? Why not? Interesting. Because in my previous relationship, she was HIV negative. We started using these. I'd been doing the gigs down at the jail. And I said, was it a hookup or was it regular? That's important. It sounds like a gag, but you know, I found if it's a regular partner, it's better. The hookup might as well just use the male condom because it's easier. But we gotta, you know, with a regular partner, yeah. And these are, I found, we started using them, 2-year relationship, never went back to the male condoms. Here's what the box looks like. Female condom 2. It's the 2nd generation. Got this at Walgreens. They're not exactly cheap. They're like 3 for $7. And inside are basically 3 big-ass condom wrappers, I guess. And I washed the KY off. And basically, this is what it is. It's a polyurethane pouch. It's got a little ring on the inside, a little ring on the outside. And so basically what you do is you get Tutti Fabulous, all juiced up with manual stimulation. If there are any Hispanics in the crowd, that would be Manuel stimulation. That's the biggest laugh I got off that joke in 10 years. Let's tell that thing down the jail. Manuel stimulation. 60 inmates, dead silence, just staring at me. And one time I did the worst thing you do in a joke when a joke dies, you know. So I tried to save the line, you know. I went, Manuel Manuel stimulation. I got absolutely nothing off of that joke either, Kind of shrunk down to, like a 6-inch Mr. Fred. Okay, let's go back to the demonstration. So here's what you do. Get her all juiced up, and you got this little ring. It's almost like a diaphragm kind of ring. And that's what you use to insert it inside 2D Fabulous. And it's got this little ring here that keeps it from falling in from where no man has returned. Hey, Bill, what are you doing down there? Advantage to these. It's made of polyurethane, which will heat up to 98.6 degrees, which is body temperature. Did you find it was better sensation? More.
I've decided I no longer like to share.
All
Thank you.
righty. I found if unprotected sex feels like a 10 on a scale of 1 to 10, these weird looking contraptions, 8.59. Unbelievable. Because that polyurethane will heat up. And the first time I used these, I wasn't prepared for how realistic it was to unprotected sex. It was like a Star Trek episode. Me and Lucky are in there, and I'm going, Lucky, I need 5 more minutes. And Mr. Lucky going, but Captain, I cannot hold 5 more minutes. But Captain, I cannot change the law of physics. And I'm thinking about dead kittens and fertilizing my lawn, overhauling my transmission, trying to distract myself, from ejaculating too soon. Another advantage to these, depending on the lady's physiology, the outer ring can run up against the clitoris, giving the woman a vaginal orgasm and a clitoral orgasm, and making us cheeseburgers look like bigger studs than we deserve to be. There's another advantage to these. Male condom, you get a little write-up, right? We were talking about fluid transmission, chlamydia, HIV. All the others are skin to skin. Male condom, you get a little write-up on that. Could expose you both to maybe a herpes sore that hasn't manifested yet. With this, you got a closed system right here. And it can protect from the skin to skin because there's really no contact. And another advantage to these, with the male condom, you're getting all hot and bothered, right? Hey, baby, that feels really good. Oh, yes, Mr. Lucky. Well, do you want to do it now? All of a sudden, Mr. Lucky now sounds like Barry White. Okay, baby. Yes, Mr. Lucky, do it to me now. And with the male condom, then it's a race against time because you got to check for holes. You got to check for the expiration date. You got to check the right. Meanwhile, Mr. Lucky's going, Mayday, Mayday, we're going down. Oh, no, we're too late. Gee, Tootie, want to go see that Denzel Washington movie again? Another advantage to these, okay? It can, one guy asked me in juvie the other day, the ring, rubbing against the head of the penis, doesn't that hurt? Doesn't that feel bad? Doesn't that? And I found in the 2 years that I used these, that's an advantage for the guys. Because when we got a full erection, those blood vessels are pumping that, rubbing against that ring, guys, feels really, 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 really good. Another advantage to these, and I don't know why the female condom is not more popular with men, which sounds kind of strange. Well, it's a female condom. Because once this is in, logistically for the guy, it's like unprotected sex. Because all the guy has to do is A, be in the room, B, have a woody, and see, we've got target coordinates 0, Charlie Niner, hit your bullseye. And so there's, one of the things a lot of guys don't like using condoms because there's a sensation. This solves those problems because much better sensation. I will say again, to reiterate, much better when you know your partner as opposed to just to hook up. If it's like a one-night stand, I tell like the kids in juvie, use the male condom. Regular parents use those. So that is the Reality Female Condom. And they are available from fine pharmacies everywhere. And final thing for men performing oral sex on a woman, he would use to protect him what's called a dental dam. And I got these from the dentist. This is a little polyurethane sheet. Had some dental work. Said, you got some extra dental dams? Give me like a dozen of them. I went, oh, cool. $1,600 for a root canal. I'm going to get something else out of this deal. And that's a little thick, but I found that online, I think it was, but some of the Fair Villa, those type places, have these real thin. And basically, it's a two-step process where you stick it and lick it. And that'll protect somebody, a male who wants to perform oral sex on a female. Always water-based lubricants when you're using condoms. Because if you use Vaseline, intensive care that has oil in them, that can melt the latex. Testing for HIV now. They've got blood test. They take some blood. They also have what's called OraSure. And this is basically, you don't have to draw blood. Is anybody, you guys familiar with OraSure?
Yeah.
Little toothpaste, toothbrush type thing. Rub it against your cheek and gum. Stick the sample in here. Send it off to the lab, about 2 weeks, get the results. They also have rapid testing now. Because I volunteer for the Hope and Help Center, and they will test people. They have rapid testing, which is much like the home pregnancy test, where if it's negative, you're probably okay. If it's positive, then you got to go to the doctor and confirm your status, whether it's pregnancy or HIV. But with the rapid test, and I have information to hand out, you can determine your results in like 20 minutes. So that's the deal on the condom. Any questions? If you thought my story could not get any more tragic, you are wrong. Because after my wife died, it's about 4 or 5 years after my wife died, I met a very nice HIV positive woman from Bayamon, Puerto Rico, where my great director is from. And we had a wonderful 2-year relationship. And then she died. And at that point, I said, this life stuff is really overrated. And, I wouldn't have to slit my wrists or gobble a bunch of Seconal and stuff like that. And this was my life plan. I was going to stop my pills, start drinking a whole bunch of tequila. And my game plan was, maybe a year to get sick and a year to die. Just kind of keel over, clutching the Corvo bottle, and expire with a smile on my face. And the universe had different plans for me because the phone rang. And there was the Hope and Help Center. And they had been a client. They'd given me grief counseling for my wife. They're a wonderful organization. Needed somebody to go to the jail. And I said, well, except for my nightly date with Senior Corvo, I don't got nothing going. And started doing this work. It was kind of like one of those JFK inaugural kind of moments, where it was like, ask not what your condoms can do for you. Ask what you can do for your condoms. That's my TCJFK impression. And I started doing this work. And because of you guys, and because of the guys down at the jail, and the kids at Juvie, and UCF, and Valencia, and all you wonderful students, I'm still here. And I would not be. And it's all because of you. And if you notice, it'll be 12 years. I've remarried. She's HIV negative. I was really lucky at that. She's a Jaboni from New Jersey. And I told her all the stuff that I just told you guys. And she said, hey, when you're from a toxic waste dump like New Jersey. I was like, hey, a little virus, forget about it. Living one of the most satisfying eras of my life. I go to Open Health Center, and I love you guys. And you can have that impact on your patients in your career. And I think a lot of my victories, probably my best victories, is some kid who never saw the Lucky Stick, never was in, Juvie or one of the classes, But because I gave a couple bags of condoms to Michelle at the juvenile center, because spring break was coming up, and she gave the condoms to Irma to give to the kids in her probation program. A girl I've never met, who never had to suffer through my lame jokes for an hour and a half, had a condom and didn't get pregnant and was able to pursue a dream of going to college. Or a kid who doesn't know Mr. Lucky from Adam, doesn't catch the HIV virus, and is able to, marry his high school sweetheart and have a loving, wonderful relationship. And sometimes that's the way in your profession. Your greatest victories can be just your influence, just your compassion, just some information, a pamphlet, a card. When we were first diagnosed with HIV, we had just a regular GP. And he told us, quote unquote, okay, you both have HIV, you're both going to die. Start making out wills, make arrangements for cemetery plots. You need to go back to the bank. You need to tell them that you have HIV. They will fire you. I said, well, I'm still relatively healthy and can help and work. Why should I tell them so that they can fire me? And his response was, well, because you just have to. And I said, okay, Doc, great bedside manner. We're going to go now and look for a new doctor. But he gave us a card. Gave us a card to the Hope and Help Center. And that changed our lives. And I have been affiliated now with Hope and Help, those wonderful people, for 25 years. And because of them, because of you, because of all my students, I am still here and enjoying a wonderful life with my wonderful life. So, thank you. You guys have been great. Does anybody have any questions? You've been a wonderful audience. Thank you, Kim. And have a wonderful day. And he nails the dismount.